From Walden University's Career Services Center, welcome to this evening's webinar, Career Opportunities in Health Informatics. We are very excited about our webinar this evening and have put together an expert panel of faculty and the program director in collaboration with Career Services. But before I pass it over to make our introductions to our guest panelists, I would like to get some feedback here from our audience about who is joining us this evening. So we'd like to know who's joining us as far as what degree you're pursuing. Are you at the bachelor's level, master in healthcare administration, master's in health informatics, or doctoral? And I'll give everyone a few moments to take their poll, and we'll share the results momentarily. So again, bachelor's, master in healthcare administration, MS in health informatics. Looks like that's the majority of you are in that program. Okay, looks like everyone's done. I'm going to share the results here. We have 9% bachelors. We're very happy to see all those undergrads joining us. 6% master in healthcare administration, 66% in the MS in health informatics, and 20 at the doctoral level. Thank you all for participating. Okay. Now I would like to hand the presentation over to Dr. Rosemary Walker, Walden University's Program Director for the Master of Science in Health Informatics program, to introduce our guest faculty presenters and subject matter experts in the field of health informatics. And welcome, Rosemary.
Well, thank you very much, Nicole, and welcome everyone. Thanks for joining us this evening as we explore career opportunities in health informatics. You've already met Nicole, and I am Rosemary Walker, your program director. Nicole, next slide. Joining me tonight is Dr. Doug Bird, who is contributing faculty for our health informatics program. He's also a senior adjunct professor of management at the University of Laverne, California, and he's been a part of the largest EMR, electronic medical record implementation in the world. Our next panelist is Dr. Mark Laflamme, who may be joining us a little later. He's a physician. And our last panelist, but not least, is Dr. Paul Tootin, who's contributing faculty also for the Health Informatics program. He's a senior consultant to the state HIE program at the Office of the National Coordinator, and he's also a leader of the Direct Projects Implementation Geographies Work Group and coordinator for the 360 Exchange Project. So what are our objectives tonight? Well, first we'll talk a little bit about the health informatics industry. We'll talk about types of jobs and settings. We'll also look at networking and building your qualifications. And last, the panelists are going to talk of their career pathways. How did they get where they are today? Right, the health informatics industry. There are many definitions of health informatics. The one I chose was from HIMSS, one of our professional organizations, and they say clinical informatics, also known as health informatics, promotes the understanding integration and application of information technology in healthcare settings. This helps to ensure adequate and qualified support of clinician objectives and industry best practices. What is the role of IT in healthcare? Well, according to the Office of the National Coordinator for Health Information Technology, technology provides healthcare providers with several things: accurate and complete information about a patient's health, the ability to better coordinate the care they give, a way to securely share information with patients and their family caregivers. A sidebar to this is that providers can share that information too. And then information to help doctors diagnose health problems sooner, reduce medical errors, and provide safer care at lower costs. Okay. Rolled into health informatics are information technology, information systems, business, the structure and function of information, and clinical applications. Now, some may wish to add more facets to this list, but you can see when you look at these, the diversity of job possibilities. So now let's move on. We're lucky to have panelists from different professional backgrounds. Everyone is going to provide an industry perspective based on his professional experience. So we'll start with Dr. Doug Bird, the vendor, trainer, and project manager perspective.
Thank you, Rosemary, and welcome everyone. It's certainly exciting to be here. And as you're learning and may already know, the world of health informatics certainly is a dynamic one, and in no way is necessarily one-sided or offers just limited types of opportunities. The demonstration of that is this seminar and webinar with the diverse backgrounds and experiences that you're going to hear from the different panelists, including myself. I've been very fortunate that I've been able to kind of be on both ends, if you will, in the world of health informatics, if I may use that example. On the one end, you have the vendor side, which are your McKessons, your Epics, your Allscripts, people that create and develop electronic medical software and then would sell that to a client, to a hospital or healthcare-based organization. And working from that side is really kind of working behind the scenes, if you will. I started on the front side, the end user side, which I'll get to in a moment, where basically all I would see was the finished product and the actual electronic medical record and how it functioned. Behind the scenes is, if you choose to work for a vendor, is where all of the nuts and bolts really take place. What you have is you have the opportunity to really build things from the ground up in many ways, and that means working in different types of databases, building things on the end user side, but oftentimes using other databases that don't even resemble what the end user sees at all. And depending upon how customizable that particular vendor's software is, you really have a unique opportunity to work very closely with your client. And that can be very exciting because there may be some things that they are looking specifically for to have in that vendor software, and depending upon how customizable the software is, you have the opportunity to do that. you're going to find a wide range depending upon the type of software company and vendor that you may decide to work for one day. Some systems are extremely customizable, where the client basically can start from the ground up and make every aspect of the electronic medical record look and feel how they want. On the other end of the spectrum, you're going to find there are some vendors where their system is pretty much set in stone, and it has very little customizability to it. Now, what that does not mean is that one of the benefits that we know about electronic medical records is that you can, as an individual end user, customize, let's say, your own particular order set or develop an ordering preference list. I think you're going to find that across the board, those types of benefits and individual customizations are pretty standard, but as far as customizing the entire system, you're going to find a range on that. Finally, from the vendor's perspective, it really is about delivering the end product to your client, helping them to implement that, and obviously providing go-live support once everybody starts to use the product. I think one of the exciting potential opportunities for anybody that's thinking of working for a vendor is that there are many different vendors that are out there that are all competing, and they're growing. So they're always going to be looking for eager individuals. Now, on the other side of that is from the trainer's perspective, and that is very exciting because what you're doing is you're then working directly with training the end users on whatever vendor software it is that they are using at their organization. And that means you could be involved with workflow meetings based upon department. So for example, let's say that gastroenterology has decided to have a standardized workflow for all of the people in their department. As a trainer, it's going to be important for you to have some understanding of that, because you have the opportunity then to train to that workflow so that everybody is on the same page. You're also very much a facilitator of change if you are a trainer, because all of the myths and all of the rumors that have been flying around all of a sudden wind up at your doorstep when you're standing in front of the room, and everybody wants to drill you with all the questions about all the things that they heard, and you have the opportunity to help them to relax and clear up a lot of those misunderstandings and misnomers and let them know what the reality is. And actually you have a unique opportunity to really get them motivated and behind the entire effort. And that certainly is a challenge, but it can be very exciting as well. As a trainer, you also may have the opportunity to develop curriculum and how the training is going to be delivered, if that's something that you're interested in. There's those types of opportunities out there. And also, you're a part of Go Live support. Again, you're not on the vendor side, but you are on the end user side. So you're working closely one-on-one with physicians, with nurses, with staff, people that are using the electronic medical record, and helping them to make sure that they're using it properly. The other unique thing about if you decide to go into training is there's always opportunities to engage in what's called optimization, which is after everyone has been trained, then it's the idea of making sure that everyone is using the electronic medical record as efficiently and as effectively as possible, because a lot of things can happen and change between the day of go live and several weeks or even several months later when people are still having questions. Finally, the project manager side. I think I would need an entire another webinar just to tell you about what a project manager in health informatics does, because if you can think of it, it probably winds up on their plate. And not to shock anybody, but it's really a tremendous opportunity to be the ultimate organizer and priority setter in the fact that the project manager is really responsible for the overall organization and delivery of training and making sure that they have everybody that was identified to be trained, that they were trained for the right amount of time, they took the right classes, they're responsible for organizing that schedule, they're responsible for making sure there's enough training rooms, that there's enough computers, that there's enough end user guides, that there are enough trainer guides for the trainers that are training the class. As a training project manager, you also act as a liaison between the hospital or the organization, the healthcare organization, and every department. So you really have the responsibility of keeping a lot of plates spinning at one time, but it's something that if you are really excited about what you're engaged in for that particular healthcare organization or hospital and really getting everybody trained, getting the hospital prepared. There's different types of project managers within health informatics. The example I'm giving is a training project manager, but you have to coordinate, communicate, and constantly be preparing to make sure that the project, in whatever form you are involved with, is delivered on time and with high quality. Back to you, Rosemary.
All right, thank you very much, Dr. Bird. On to the next slide, please, Nicole. We have another industry perspective. Dr. Paul Tooten will talk about the consultant and government perspective.
Great. Thanks, Dr. Walker. Yeah, so it's my pleasure to be here. As Dr. Walker had mentioned in my introduction, I serve as a senior consultant to the Office of the National Coordinator for Health Information Technology, which is housed within the Department of Health and Human Services. Much like Dr. Bird had mentioned, I've had the benefit of a variety of different perspectives, not just serving as a consultant to the federal government, but working as a vendor, actually for probably the more predominant portion of my career. But as of late, I've had an opportunity to sort of use my expertise in this role with the government, and it's been a kind of an enlightening process for me, and so I wanted to share a little bit with you all as sort of what the government perspective on health information technology is sort of broadly, and how that is influencing this particular market and industry. So like all good stories, you have to kind of pick a point at which to begin the story, and certainly the role of the federal or state governments in healthcare has existed for decades, but I'll actually sort of pick up this particular thread in 2009. As many of you probably remember, at that period of time, there was a bill often referred to as the stimulus bill that was passed. It was actually the American Recovery and Reinvestment Act, and as part of that, there was a sort of subset act in it known as, at least sort of for short, the High-Tech Act of 2009. And that actually provided something on the order, depending upon who you have counting for you, about $25 billion, that's billion with a B, dollars in incentive payments, grants, and programs funded by the federal government, specifically focused on health information technology. You know, I guess I would argue, although when most of us think of healthcare and the federal government, you know, broadly there tends to be a kind of a focus on the Patient Protection and Affordable Care Act, otherwise the sort of so-called Obamacare. But in terms of health information technology, really the High-Tech Act has been a pretty significant driver. And really it had sort of three goals, primarily that influenced its adoption and the particular programs that were part of it. One of those being to improve kind of population health broadly. The second one to enhance kind of individual patient outcomes. And then the third to ultimately bend the cost curve of the healthcare delivery system within the country broadly through the kinds of efficiency and savings that are made possible by technology. The key components of the HITECH Act, probably the most popular one for those of you that have been around health information technology for a while, you've probably heard this term, meaningful use, which is an incentive payment program to eligible providers, eligible professional providers, and eligible hospitals. Basically, that encourages them to adopt electronic health records or electronic medical records. Those electronic medical records, in order to be eligible for this program, have to be certified, and I'll come back to that in a moment. And then they have to be utilized in a meaningful way. So how is this kind of operationalized in practice? Well, the meaningful use incentive payments are actually provided under the Medicare and Medicaid programs. So CMS administers that and actually writes the regulations that specify the kind of activities that these eligible providers and eligible hospitals have to be engaged in order to be, a kind of quote-unquote meaningful user of this technology. ONC, so the place where I work on a daily basis, the responsibility of ONC is really to define what constitutes certified EHR technology. So there's sort of this relationship between the technology which supports the activity of meaningful use. And so that's really ONC's role, and that works really based on either existing standards, so looking at standards setting bodies like IHE, for example, and applying those to electronic medical records, or the other possibility is creating some of those standards. And in fact, some of the work that I've done, like with the DIRECT project, directly, no pun intended, is then integrated into this sort of certified EHR technology definition. I should also point out that it's a multi-year, multi-stage type of program. So there's new editions of both certified EHR technology and meaningful use, stage whatever, that are issued at intervals. We're currently in sort of the first stage of meaningful use right now, although this past August, the 2014 edition of certified EHR technology and the corresponding meaningful use stage 2 rules were released, the final rules to the public. So there's a lot of activity going on within vendors right now that are working feverishly towards completing their sort of software upgrades to support the latest edition of meaningful use. So that way this time next year, providers will actually be able to start implementing that technology and gaining meaningful use stage 2 credit for having done so. This is actually really important because it increases the sort of economic impact of meaningful use and also then encourages a kind of continuous improvement process as related to this. So it's not a once and you're done. You don't just sort of install it and stay on, Windows 95 forever, right? You have to keep upgrading as the cycles change. So stage 1 sets the baseline. Stage 2, which is what we're moving towards here in the very near term, increases the emphasis really on interoperability and exchange of information, and then also increases the focus on patient or consumer engagement. So really getting kind of the patients involved with their own medical data and information is key as well. The HITECH Act also includes some other sort of lesser-known programs, but ones that are, I think, kind of equally important. One of those is around encouraging the development of state and regional HIEs, recognizing that sort of silos of data just aren't as useful, right, as data that's securely shared amongst people that have a need to have access to that information. as well as support of a nationwide health information network. This is actually the kind of primary area of work that I do as a consultant, because my primary background is really more on sort of a telecommunications and data networking type of thing. So most of the work that I've done kind of historically through my career has focused more on sort of moving data as opposed to manipulating it in a given location. And so my work as a consultant tends to focus on this. I probably should pause here a little bit and just mention, kind of as a segue, a couple of thoughts on consulting. You know, when you hear someone sort of describe consulting as a career path, it really can mean a lot of different things to a lot of people. In my case, I'm probably closer to what one would sort of typically think of as a consultant, in the sense that I'm one who consults around matters of both technology and public policy related to these things. But there are also a number of other kind of career opportunities that are broadly would be defined under the category of consulting. We are working in really any of these environments. So you could be a consultant that's working very closely with providers. You could be in a fairly technical capacity, or perhaps in a more business capacity. You could be serving as a consultant that works with vendors. You know, the general characteristic of consulting is that you have some form of kind of specialized knowledge or skill that you're applying, you know, to kind of a particular domain. And it's oftentimes something where, by it's kind of more efficient to sort of bring you in as an outsider for what is typically kind of a limited engagement or a period of time to sort of do that work and then, you know, move on to the next assignment. Certainly, if you want to have a career in consulting, there are large consulting firms that specialize in this sort of thing. And if you have a background in health informatics, you know, they have practices built around that. So you probably would start as an analyst and move up from there. But that's the sort of work that I do within the state HIE program. Turning back to high tech, a couple of the other components that are associated with it are regional extension centers. This is actually one of those areas where, in some ways, the folks that work in a regional extension center serve as kind of quasi-consultants to the providers within the communities that they serve, to provide assistance and sort of recommendations with respect to how those providers adopt certified EHR technology. The high-tech program also includes a number of challenge, innovation, and research grants. Some of those very focused on kind of federal health architecture things, or as the White House CTO often talks about, data liberation out of CMS, Medicare, Medicaid programs that are made available for sort of public health concerns. Others are much more sort of technology innovation focused, but exciting stuff to track there. And then more broadly, just to sort of help coordinate federal and state HIT policy. The Office of the National Coordinator, prior to the HITECH Act, was started under President George W. Bush, his administration, by executive order. In the case of the HITECH Act, though, ONC was actually sort of memorialized in legislation, so now is a permanent office by which the Secretary for Health and Human Services appoints a national coordinator to that post.
Paul, this is
Yes.
Lisa Cook. Actually, I have a question relating to your content that I'd like to pose to you from a question.
Sure.
I'm sorry, a question from one of our students. Could you please explain what meaningful use means? Because it's hard to understand that. And this question is from a nurse who presently is making design decisions from the operating room.
Yep, yeah, no, absolutely. So in the context of an electronic medical record, there are obviously sort of software attributes that are associated with that. And so what meaningful use really talks about is the kind of characteristics of the way in which you utilize that technology. So it may mean, for example, that in the context of like a transition of care, so if you're say, a primary care physician and you're referring a patient to a specialist, meaningful use under stage 2 says that at least 10% of the time you're going to go ahead and bundle up all of that data, or your EMR is going to do that. Hopefully you don't really have to think a whole lot about it if your EMR has done a good job of managing the workflow. And bundle all of that data up into something known as a consolidated CDA and ship that over to whoever the specialist would be that's receiving that patient as part of the transition of care. And there's some number of those types of standards. There's measures related to public health or the use of CPOE, so for physician order entry in a computerized fashion. All of those things have kind of different metrics associated with them, the number of e-prescriptions written, those kinds of things. So in essence, there are folks that sit down from a public policy perspective, think about the capacity that this certified EHR technology has, and then in essence puts down kind of metrics that providers who want to receive these stimulus payments would receive. So that's sort of the nature of meaningful use. And in essence, if you do those things, or some subset of those things, you're then considered to be a meaningful user of this technology and thus receive the incentive payments for it.
Excellent, thank you. Okay, if it's okay, I'm going to just break in for a minute because we are just getting so many student questions right now. So I just like to take a few minutes and pose some of these questions to all our panelists. And thank you, Paul, because that was a really comprehensive overview. So I appreciate that. A common question that we seem to be getting in is, what kind of background do you need to break into the informatics field? For example, do you need a nursing or a programming degree to break in, and what kind of backgrounds are acceptable for entry-level positions in informatics? So I'm just going to throw that out to all of our panelists, anybody who'd like to field that question, because we've gotten that from several students.
Sure. And the other panelists are welcome to chime in on this. You do not need a healthcare background. You do not need an IT background. You do need something to bring to an employer's table, but there are consulting firms, there are organizations that are looking for people. They're willing to train them to come in on the ground floor level. So, you know, I've heard, well, do I have to be a nurse? Absolutely not. Dr. Tootin is not a healthcare professional. Dr. Bird actually did start as a healthcare professional initially, but he kind of segued beyond that. But you can come from a business background. All those different facets that I mentioned earlier are ways to get a toehold into the industry.
Excellent. Okay, terrific. Thank you. And I know we have another speaker coming up, Dr. Mark LaFlamme, so we're looking forward to hearing from him. So thank you, and we'll pose a few more questions later on. Thank you, Rosemary.
Great, and I would just like to introduce him. He is contributing faculty, a board-certified internist. He's also board-eligible in clinical informatics, and he is a former physician consultant and executive with NextGen Healthcare and EMR and EPM Corporation, and he's currently the medical director for 4 medical practices in the greater Tampa Bay area.
Good evening, everyone. Hopefully everyone can hear me. Is that, am I okay or am I too loud?
We can hear you great. Thank you.
Great, thank you. Appreciate that. You have to excuse me in terms of how I'm going to do a presentation. I know it's limited, but it's difficult for me in terms of the dichotomy that I have as a clinician and as an informatician. You know, being fellowship trained in medical informatics, which I did research in, I published, and also being a consultant for NextGen Healthcare, who has the largest market share of ambulatory practices in the United States. You have a wide array and diversity in terms of how clinicians relate to the electronic medical record, and they're separated into two types of clinicians. One is their office-based, and the other one is hospital-based. And you can be guaranteed you're going to experience some resistance because you will see hospital physicians say, there is no way in terms of how I practice that I'm going to allow this. I already have HMOs that tell me what to do. I already have pharmacy benefit managers tell me what medication to prescribe. I'll be damned if I have a CFO or a CIO tell me I'm going to use a system that I don't like. I had no choice in the matter, and I didn't sure as hell didn't pay for it. So why would I want to use it? So unfortunately, when it comes to hospital executives, they look at these clinicians and say, listen, you're going to play or you're not going to be with us anymore. Why? Because in these days, it's dog or die. You know, when I had my interview with Patrick Klein, the former president of NextGen Healthcare, I looked at him right on the teleprompter and I said, it's dog or die. Because no one has a monopoly in terms of the use of these systems. You have to channel your energy to the smaller hospitals, 5 to 20, the smaller practices, 5 to 20 clinicians, the smaller community hospitals, because they're the ones that are going to be behind the ball or they're not up to date in terms of their hospital systems. That being said, as a clinician, when I look at it in an EMR, and it's your job in terms of you, if you're part of the vendor or you're part of the organization trying to push an EMR, you have to explain to the clinician that this is a tool. It doesn't replace anything. It enhances in terms of what you do. Because if you look at the way physicians practice, part of it is an art. Because these clinicians have an idea of what's the most efficient, or what's the most beneficial for the patients. And sometimes they're very sadly mistaken because they're stuck in their ways. These are ways that they were integrated in all the way back in medical school. The other thing is, in terms of the way they practice, they think they have certain parameters that they absolutely need to have when seeing these patients. For instance, I was at a practice in Texas in which there were 14 cardiologists in which they had 11 different ways when they did how they did vitals. Why would you have to train these MAs if they may have 3 different cardiologists working under during one day, and they have to figure out, okay, how am I going to do these vitals? So what's the validity with it? Why do these practitioners want it done this way? Well, that has to go with clinical-based, evidence-based medicine. If you look at the research in terms of why they are doing certain ways, they're trying to explain themselves either A, by looking at research, or B, just satisfying their own egos. So you, if you are part of the solution, you want to herd these clinicians together, and trying to herd physicians is like trying to herd cats. Believe me, I have a hard enough time trying to organize my day since I'm the medical director of 4 practices. Needless to say, it is very difficult to get physicians on the same page. But what also helps is the ancillary staff, because the ancillary staff serves as the carrot to the mule. In other words, if you're just doing a part of the implementation when it comes to the EMR, you want to make sure that the clinicians have access to the 3 most common things that they need: RADs, MADs, and labs, radiology, medications, and laboratory results. And in doing so, you as the ancillary staff, you tell your clinicians, I'm not going to print it out for you, but you can look at it on that computer screen over there. You have a username and a password, I suggest you use it. And in doing so, that's the impetus of utilizing clinicians to get onto the system. So how does this work in your benefit in terms of a career? Well, let's say you are part of the solution in terms of implementing the EMR, so you need to find ways of being more efficient. So it comes down to a whole analysis in terms of your office and how all the rest of the ancillary staff fit into this EMR. Because certain ways in your practice is going to have to change. And you as the mouthpiece in terms of the change when it comes to implementation, you better be sure in terms of A, who these people in the chain are, B, what their job titles are and that there's certain job descriptions, and C, putting those pieces of the puzzle that's going to fit them in the workflow. Now, who's good at that? Well, nurses are great in terms, specifically nurse informaticians in terms of looking at clinical workflow, more so the hospital than the outpatient setting. But in
Dr.
doing,
Slam, can I interject for a minute?
Sure.
Can you tell me, because our students are so interested in hearing about the different types of settings that hire people in informatics, and I know you've got a wealth of expertise in terms of the hospitals, but Are there other types of settings where informatics folks will find a lot of opportunity besides hospitals?
Well, let's break it down for a second. And that's why I'm trying to go through this workflow process in terms of where certain roles can be filled in when it comes to informatics. So if we start at the beginning when it comes to a system, okay, so you have sales, you have marketers who don't always tell the truth. I hate saying that. But also customer service. If you have some sort of informatics background, you are able to utilize your information better in terms of being the conduit between the clinical staff and the IT staff. So if you look at your role as in the go-between, understanding both parameters, you are able to provide a bridge between the two worlds, if you will. Because you have to look at implementation as a clinical project, not an IT project. Again, because of the tools that it brings to the clinical picture. The most common jobs that are out there right now, and I look at these every day, whether it's from Beyond.com, Indeed.com, the job mine on HIMSS. The two biggest ones when it comes to a clinical background is being a nurse or being a pharmacist. Those are the two most common ones now, more so than a physician, more so than a physical therapist, more so than a medical assistant. Now, not to say that those won't change in the future, but I'm saying that those are the most common at this present time. Now, as my other panelists had mentioned, when it comes to incentives like meaningful use, you have certain data that's allocated. Now, granted, if you have the right type of EMR, then of course it's easy to allocate that data and bring that to the front in terms of reimbursement when it comes to Medicare, Medicaid services. However, not all EMRs are created the same, and you need someone to mine the data. But in order to mine the data, you have to understand the system. And when it comes to systems that are being implemented, you're going to need super users for each practice, whether it's the physician, whether it's the nurse, whether it's the MA, whether it's the billing manager. Someone has to be has a good understanding of how the EMR works. And not just every nook and cranny, but if we're dealing with data, we have to find a way in terms of how to grab that data and push it in the right direction. And having that informatics background, of course, makes it more feasible in terms of finding where that data is and what it exactly means. Because the data is only good in terms of what is being entered. The old saying goes, garbage in, garbage out. And if you don't have the appropriate training for these clinicians, of course they're not going to be able to enter the data inappropriately. They're just going to put in dummy data. So if you are a trainer when it comes to utilizing the system and you have the knowledge of informatics, so that's a feather in your cap. Again, because you're serving as the bridge between the clinical side and the IT side. That is invaluable when it comes to these type of projects.
That goes to a specific student question actually that's been posed. So Marie asked, so if I view myself as a go-between and I have a clinical background and some informatics experience, what types of positions are available? And I know Rosemary's got a couple of slides coming up also to talk about that, in addition to talking about the academic preparation. And I'm just concerned about the time here because I think we have about 10 minutes left. So if it's okay, we're going to switch to the academic preparation now. That's okay. So thank you so much for that overview. That was terrific. So Rosemary, we're going to go to academic preparation.
Okay, I'll just spend, you all can see the different types of programs that are available to prepare you for careers in health informatics. So let's just go to the next slides and get into the meat of careers. All right, so somebody wanted to know about work settings. There are a wealth of work settings. You've got vendors, consulting firms, academic institutions, the government, hospitals, insurance companies, managed care organizations, professional organizations, and research organizations. Next slide, please. And this is a list of 15 jobs and only 15 job descriptions. So the panelists have mentioned different kinds of jobs. Dr. LaFlamme mentioned the intermediary. He mentioned trainers. There are countless jobs out there. and they all pull from different backgrounds. So if you have a business background, you may have, and you have experience in project management, that's translatable to the industry. If you're starting from scratch in the implementation specialist, that may be a good position for you. I mentioned how some of the larger consulting firms, like Epic, will take people from programs. At least that was the case previously with Epic. So you can see jobs come from all over. Next slide, please. Great. Well, then I'm going to turn it over to Nicole, because one of the most important things that you can do to get into the industry is to network. So, Nicole?
Yes, thank you very much, Rosemary. Excellent. So now that we've covered the types of jobs and work settings for the field of health informatics, we're going to talk a little bit about really the importance of networking and branding as a part of your ongoing career management. So as we all know, this is a very competitive job market and economy, and really engaging with others, both online and offline, is really key to your career success. But before engaging in proactive networking, it's really important to develop a clear, memorable message when introducing yourself to others. Now, of course, branding and networking could be a whole webinar in itself, and actually on the career site we do have some more information, so I am limiting it to a few slides just because of our time constraints. But before we do get into the details, I would like to pose another poll for our audience to find out a little bit about how you're currently building your network. So we have through volunteering, networking internally at work, externally through professional organizations, and online via social media. And many of you, looks like, are also using a combination of these strategies. Excellent. Okay, we'll give a few more seconds for everyone to answer the poll. Okay, and we're going to close it up. It looks like about half of you are using multiple strategies, hopefully both face-to-face and online. And many of you are networking internally at work and also online using social media. Excellent. So we'll continue on here. The first step really in successful networking is to develop a really strong personal brand. Why is that? Because your brand is what is really unique about you. It's what makes you stand out, and your brand is your reputation, and it's really your competitive edge. So you want to think about ask yourself some questions. What makes you stand out from other professionals in your field? Your interests, your skills, your personality, your academic achievements. What are you known for? How do you offer value and solve problems for your audience? Also, how do you help the organization where you work achieve their mission? And you should always play to your strengths and play to your passions. And actually, we have a few resources that can help you to get started with your brand and your elevator pitch. So what are your skills and strengths? What can you say about yourself that will set you apart again from others in this as it relates to your future role? So of course your academic program also at Walden, your transferable skills from previous positions, and again, what are your research? What's your research interests? After assessing your skills and identifying your strengths, then you'll want to develop a strong elevator pitch just to help you to gain more confidence in networking activities. So here are some resources to help you to do that. And again, this webinar, the slides will be posted on the website, so you'll be able to access those. This is a very important, as it does take, research shows it does take 10 to 20 seconds to make that first impression. So these introductions can be very important also during interviews when you're asked the question, tell me a little bit about yourself. So an example of an introductory elevator pitch would be, I am an education administrator who enjoys coordinating education programs, supervising faculty and staff, and improving the overall quality of education for adult learners. And also there's a great website called 15secondpitch.com, and it's 15 written as the number as you see here on the slide. Another thing that we highly recommend to students, I think I jumped there, is to engage in professional networking activities. And the #1 way to do this is to join a state or local chapter of a prominent health informatics professional association, and I'll be sharing some of the top ones on the next slide. Take on stretch assignments in your workplace, and this could take the form of collaborating on a committee, taking the lead to improve a process, or offer to deliver a brown bag lunch session. Also LinkedIn, of course, using your LinkedIn site to promote your brand, maybe even starting a blog. Make use of that technology and social media to also share your expertise and build your brand, also given that you're wanting to move into a technology-oriented field. If you are a doctoral student, connecting at Walden residencies with other Walden students and alums, also via LinkedIn and the Alumni Association, and engaging in your campus community online. So even creating a local group or an online group and engaging in group discussions. So next we have some of the most highly recommended professional associations, the Healthcare Information and Management Systems Society. They also have amazing resources and many times job boards on the website. So again, we recommend getting involved locally. Why locally? Because then you can meet other professionals in the field in your geographic location in a face-to-face environment. And maybe go to conferences and networking events and really be in the know on what's going on in the field, and possibly get referrals for job opportunities or internships. Okay, so those same professional associations are very likely to have LinkedIn groups. And actually, I did research for the webinar and found that all of these professional associations do have LinkedIn groups. Many of them have huge numbers of members in the groups, over 18,000 members in AHIMA. So very, very broad groups for you to join and get engaged in, and there are always recruiters. And here I found a Healthcare IT Careers and Job Opportunities group with 16,000 members. So really, again, just amazing opportunities to get involved. Once you get in the group, people can view your profile. You can engage and pose questions or answer questions. So I did really find a variety of groups, and here are a few more that I found. So really be observant when you're in a group, engage with others, and of course connect with them as well. And for those of you that are on LinkedIn, which we highly recommend, you'll want to showcase your brand online as well, using some of the LinkedIn features. So making sure you create a strong tagline. So a tagline is related to your 15-second elevator pitch. Join groups, and I just recommended a few groups for you to join. You can follow companies on LinkedIn. You can answer questions through the answers function. You can have a link to a blog or your Twitter feeds, or there are many ways to almost kind of showcase your skills and your technology expertise on LinkedIn. And finally, you'll want to increase your marketability. And here are some possible action steps for you to take to promote your brand, increase your marketability, and thus your employability. So get published, present at a conference, assume a leadership role at work, volunteer with a professional association. It's really a great way to meet people in the association, serve on a nonprofit board, We talked a lot today about training. You could develop a training manual. There are just many, many ways that you can get involved, and then you can showcase that on your resume, on your LinkedIn profile, and get exposure for yourself, and others will start to recognize you for your accomplishments. And with that, I'm going to hand it back over to Rosemary. And we just have, it looks like, a few minutes left for the pathways, and then we'll open it up for questions.
It looks as if we're going to go a little overtime tonight, so that please be patient with us, students in our audience, because it looks like we might go overtime tonight. Okay, so we hope you'll stay with us. Thanks.
Do we want to do some questions now, or do we want to pursue the career pathways?
I think the career pathways would be great, because I think that'll address some of the questions we're getting in. So that would be great.
Okay. Dr. Bird, do you want to briefly outline how you got into the industry?
Sure. As was mentioned, I do have a healthcare background by first degree, but that really played no part in how I got my first job in health informatics, which was as a trainer. It was more because of the teaching background that I have and the education background. So certainly having the healthcare background could serve me well, but that was not a requirement that the place where I started was looking for. And they were hiring literally hundreds of people over the course of several months, and it just sounded like something I really wanted to get into because I was very interested in it. And as a result, because of this one skill set that I had, training, educating, teaching, it all was able to come together.
Okay, thank you. Dr. LaFlamme, what was your pathway? We know you started as a physician, and then what took you to informatics?
Well, that's incorrect. It wasn't started as a physician. It wasn't even started as a medical student. It was before, during graduate school, when going down my path before I became a physician, I always asked the question, how can computers be involved in my career in medicine? Then, of course, right there in Boston, when I was in grad school, there was the Partners, which is the affiliate of Harvard University, and they had a telemedicine program headed by Dr. Kavadar, who's a dermatologist. All that fell by the wayside after 9/11, simply because of the fallout from the incident. So a lot of international involvement fell by the wayside. Needless to say, I tried multiple times to get into that particular branch of Partners without success. When I went to medical school, I kept asking the question, how can I do this, how can I do this? And it wasn't until I got into residency that I discovered that there was a telemedicine and telehealth conference in Bethesda, Maryland, and I asked my senior residents, hey, can I go? And I went, and I discovered this whole sub-network of clinicians who are involved in computers, and I found out what it was called. It was called medical informatics. I said, I had no idea. And they said, yeah, by the way, you have the chairperson of your radiology department at the hospital you work at. I said, maybe you should get an appointment with him, because he happens to be an associate professor of the Department of Bioinformatics at Columbia University. So after I met with him, I was able to send off some emails, and I met with Kathy McKeon, who is the head of the Department of Computer Science at Columbia, and I had a very nice meeting with her, and at the end she said, yeah, we can use someone like you in our research department, but I can't pay you. I said, I don't want you to pay me. I said, I want a sparkling letter of recommendation. So with every free time that I had during the rest of my residency, I traveled all the way from the center of Long Island to New York City. You can imagine what traffic is like on Friday at 3 p.m. trying to get from the center of Long Island to get into Manhattan. But I did it every time and every chance I got. I was involved in at least 2 projects, and in doing so, because I did that, that's how I was able to secure my spot as a fellow at the Regan Street Institute at Indiana University School of Medicine. And working under the tutelage of Dr. Clem McDonald, who will be presenting at HIMSS 13 in New Orleans in terms of the evolution that the emergency medical, the electronic medical record has changed over the past decade. So that's how it went. From there, I became a consultant at NextGen, and right now I'm pretty much clinical, and I'm glad I did because it gave me a better understanding in terms of how clinicians are dealing with modern medicine. Unfortunately, when it comes to dealing with insurances, it can be quite emasculating in discussing with people who have no idea what medical terminology is, and in trying to deal with patients and how they want to have access to information, and trying to deal how to disseminate the information in an organized and structured fashion, trying to get away from written notes because doctors' handwriting, frankly, is horrible. This is from someone who used to receive penmanship awards when he was in grade school. So you can see how the evolution of medicine can become a mutation, so to speak. So that's how it all happened.
All right, thank you. Well, I think I should share mine because my transition was not smooth at all. So I sympathize with those of you who are going, gosh, how am I going to break into this field? I started as a dentist and knew that I couldn't do that for the rest of my life, but I had no idea what to even go into. And so I got an MBA, which was very nice, but it didn't lead me to a specific job. I was told by one consulting firm when he looked at my resume, all he saw were teeth. And so I applied upon graduating from the MBA program. I applied to, I believe, every large consulting firm in the country. I did not get a job with any one of them. As Nicole was talking about with networking, I learned to be a good networker because I worked at Smith Barney for a brief period of time. That did work, but I did learn from an expert how to network. So I literally would call people on the phone, different businesses, ask about the job. I said I was doing an informational interview. Tell me what this position is like, and at the end, do you have somebody else I can talk to? This went on for quite a while, and eventually somebody mentioned to me that something was going on with privacy in healthcare, and I thought, dentist, healthcare, okay, maybe I can do something with that. So I started a degree in management information systems. I went through Microsoft's Microsoft Systems Engineering program, and I finally got smart, called the American Dental Association, and I said, don't you have a job for a dentist who knows something about technology? And they did, but it wasn't quite the job I had anticipated, and I was perpetually looking for the perfect job, the perfect area to break into. And just through an internet search, I latched on to Health Informatics and found that there was a program, I was in Chicago, that offered at that point just a certificate in it. So I started taking those courses. It grew into a master's program. And then I was faced with, now what do I do? Because when you look at the field of informatics and you're looking for a job, you can't go up to an employer and just go, I need a job. It's like going into Nordstrom and saying, I need clothes. I mean, where do you start? So I received some very good advice, and I was told somewhere in your program is something that will resonate with you, and that's what you're going to become an expert in. So I was 3/4 of the way through the program going, there is nothing here, and I was taking a 2-credit-hour elective, and there was a topic that was briefly mentioned because this was quite a few years ago, and I was talking about this new law called HIPAA. And so I started thinking, now that interests me. And so because it was new in the industry, I figured I can be an expert in that. So I took the law and I read it, and I became an expert in it. There were public comments at that point. I read, this was a thick book, all the public comments. And that was what I was going to do. I was going to become a consultant with HIPAA. But in the meantime, I was finishing the program and complaining about the courses, blah, blah, blah. And then the program said, why don't you come in and become a faculty person? And I thought, okay. And so that's what I did. So I actually gave up on HIPAA, and I became an academic in health informatics. So I took quite a long circuitous route to get into the field. You're getting a degree in health informatics for the most part, and so at least you've localized the field. Now you need to figure out what resonates with you, what can you focus upon and become an expert so you can sell yourself to an employer. If you have a job in sales, you heard Dr. Bird talk about vendors. If you are in, as he was talking also, if you teach, if you're a trainer somewhere, that's translatable to the field also. If you're a business person, you've done projects, you know how to interact with people, that translates itself too. There's going to be something about you that will translate to the field, and that's what you need to cultivate. All right. So at this point, Dr. Tootin isn't here. Should we do some questions now?
Rosemary,
Yes, thank you, Rosemary.
Oh, I'm sorry.
Oh, go ahead,
A very common question. Thank you. Thanks, Nicole. A very common question seems to be, and I think you touched upon it in terms of picking a specific area to focus on, to really drill down and really become an expert in, to set yourself apart. But so many of the students are saying, you know, I don't have the IT background, I don't have the health background, how can I break into this field? What are ways that I can gain experience to, you know, be marketable and be competitive, and what types of settings are going to, you know, take someone like me and train me in this field?
Well,
that's a whole lot of questions combined into one, so I apologize for that.
And Dr. Bird, Dr. LaFlamme, feel free to break in at any point, but I have to tell you, if you have no experience in the field at all, you've never walked into a hospital, you don't, you know nothing, you have no experience whatsoever, I would say you should look at the practicum in the program, because the practicum will give you experience. You pick the healthcare organization where you would like to spend 8 weeks, and find a project that you could possibly get involved in at that institution. That's the best way at this point for you to get some kind of experience like that. Dr. Bird, Dr. LaFlamme, do you have anything to add to this at this point?
Yeah, I'll interject in terms of where should you go. The most important thing you can do is how you're going to utilize your time. listen, look at Andy Cohen, who's the program director of Bravo TV. How did he get his start? He was an intern. And he wasn't just an intern, he was an intern from multiple institutions and eventually with CBS News. And look how he was able to move up the chain. Why? Because with his internship, which he didn't get paid for, he was able to make the adequate connections and appropriate the knowledge in terms of him becoming where he is today in Bravo TV. The way I did it, I wasn't paid, but I decided to network myself within my own hospital to figure out where I could find out what this specialty was about. So if you have any keen interest, find out where in the institution it can be found and volunteer your time, even if it's just 2 hours a week. And sometimes you may not even have to be there. They'll say, you know, we could use you to telecommute at home, or we could use you to analyze this data, or we could use you to call certain people so we can get more information in terms of what the research and what we need for our institution. Again, if it's just 2 hours a week, and if you work as hard as you can and do the best you can, people notice that. And they'll refer you to someone else. Hey, I had this great intern who worked for me. They did a spectacular job. It was involved in this project, and maybe you should consider this person for a position.
I agree with that. Also, too, as Nicole mentioned, it's in networking. I have attended, for example, I'm in the Chicago area. There is a chapter of HIMSS here, and they have functions periodically. And when you network, if you do it well, you're really, it gets kind of scary, but you literally go from person to person, not asking specifically for a job, but picking their brains, and you can let them know, hey, I'm looking, do you have any ideas to help me break into this field? Eventually, you will find somebody who will have a really good suggestion for you. So, I'm going to fall on, besides volunteering, networking.
Terrific, thank you.
And
Well,
I think
we're just
overall
at the wrap-up point, because we're about 15 minutes over. So I think if it's okay, I think because you guys gave excellent suggestions, and there was just such a wealth of information. But I think if it's okay, we're just going to wrap up now.
Okay.
So Nicole, you want to take this?
Yep. So thank you very much, everyone, for all of your input. We just want to wrap it up by reminding everyone, here's the Career Center website. So we encourage students to connect with the Walden Career Center using any of the resources above. You can schedule an appointment with us. We can critique your CV. We have a LinkedIn group as well. You can connect with us on LinkedIn. We have a WordPress blog where we highlight success stories. So there are many ways to engage with career services, and please, you'll definitely want to take full advantage of our services. And here is a shot of our LinkedIn group, and I just took this shot the other day, and we're now up to over 1,000 members. So you can interact online as well and grow your network that way. LinkedIn is the top professional online networking site, so we do encourage students to join. And we have a few Health Informatics excellent websites and web resources for students to utilize, with data and research information and job boards as well. Here are some additional resources. And finally, we'd just like to thank everyone for participating and attending this very informative webinar. And thanks to all the faculty for sharing their expertise and their time and their valuable information with students. And we'd just like to end it with this quote: informatics is the intersection of people, information, and technologies. And one last reminder that you will receive a brief survey at this time at the end of the webinar, and we greatly appreciate your feedback. And thank you, and have a good evening.